And if you haven't yet signed up for the daily email, I would encourage you to do that at governor.ri.gov. Although we are resuming our lives more normally, going out, going to school, going to work, there's still a lot of information coming out about testing, about therapeutics, about a vaccine, about the risks of coronavirus in Rhode Island. So I would encourage you to continue, please, to keep yourselves informed, to tune in at 1 o'clock on Wednesday, and to go ahead and sign up for these daily emails. So we begin, as we always do, with the data, and I'd ask if you could please put the dashboard up on the screen. You'll see it's a different looking dashboard. Last week we started with a new dashboard with a little bit more information to show you trends. I find it helpful. I hope you do too. Yesterday we performed over 9,000 tests, so it's a huge number of tests, and we saw 173 positive cases. So that is a percent positive of 1.9%. It's a little higher than we've been seeing, still excellent, below 2%, but you know, we'd love to be even lower than where we are, and so we want to make sure we stay vigilant. And sadly, we had one more death yesterday. A week ago, I announced that we just passed the milestone of 700,000 tests, and today, 1 week later, we've performed 770,000 tests. I will say a big thank you to everyone who's been involved with the testing team. We continue to lead the nation, and testing, it's actually now more important than ever. Now that the kids are back to school, more of us are out and about and working. Testing is key to keeping a lid on the virus and allowing us to live our lives. So I want to encourage you all to continue to get tested, and I want to thank everybody who's been involved in enabling so many tests. As you can see from the screen in front of you, and if you look at the trends in data, the percent positive, our weekly percent positive, has slightly decreased from last week, from 1.4 to 1.2%, and our cases per 100,000 has also decreased from 73 to 70. So that's good news. Good news, arrows pointing down is a good thing. It largely reflects the fact that we have acted very aggressively to get our arms around the outbreaks at Providence College and URI. Unfortunately, our weekly hospitalizations have ticked up, as you'll see on the screen, from 43 to 66. That isn't something that we want to see. Having said that, it isn't reason for panic. 2 weeks ago, when we saw 43 hospitalizations, it was an especially good week that week, and 66 is relatively consistent with the weeks prior. The weeks prior were 59, 58, and 66 respectively. So long story short, you see an increase from 43 to 66. That doesn't make you feel great. However, I don't want you to be alarmed. It's well below our hospital capacity, and 66 is roughly consistent with where we've been over the past month or so. Having said that, there have not yet been any hospitalizations, as far as we can tell, related to the outbreaks at PC or URI, and hospitalizations are a lagging indicator, so we're going to keep our eye on it. Bottom line is, feel confident, we're in good shape, we're keeping our eye on it, we're in constant contact with hospitals, ample supply of PPE, ventilators, and hospital beds, and just continue to follow the rules. As always, I want to provide a very quick update on the weekend report and what we saw in our business inspections over the past week. And of course, I want to thank the inspectors at the Department of Business Regulation for doing a fantastic job. It's not a fun job, but they're doing it, and they're doing a terrific job. So they inspected about 1,000 businesses last week, and overall, the headline, great compliance. Mask wearing, high-touch cleaning, compliance with capacity restrictions, all over 95%. area where I still would like to see us do better is health screening of customers and staff. So this is the symptom screening of customers and staff. It's at 89%. That's something, there's no excuse for that not to be at 100%. In fact, the simplest thing is, if people have downloaded the Crush COVID app and they do their symptom tracker, simply ask them to show you the green smiley face. You know, that's enough. You don't have to have, you don't need to take temperatures, although if you want to, you can. But I'm asking you, please, for the 11% of businesses that still aren't doing the health screening of customers and staff, and for some of the manufacturers that need to do a better job of screening every single day, every employee, please try a little harder so we can go from 89 to 100%. Bars continue to do a good job, and I know this is a very difficult time for you. I would just say that crowding in the bar area, we saw a little bit of a dip in compliance, and the number of bars that had customers too close to bartenders doubled from 7% to 14%. This is the first time in almost 2 months that we've seen the number in double digits. So look, 14% isn't alarming, but it means we're getting a little too relaxed, maybe a little lazy following the rules, and I'm asking that we do better, that bar owners and those of us who attend, you have to try a little harder. You cannot crowd the bar, you cannot get too close to the bartender. That's how people get sick. Those are clear super spreader type events, and we're going in the wrong direction. So I'm asking you now, please, if you're going to go into a bar, if you own a bar, if you're going out for dinner and go to the bar area, please, please, if you find yourself in a crowded space, stop. You're doing something wrong. You know, back away, go get some space, go back to your table. Also, we are seeing a little too much crowding outside of the bars, people waiting for a table, or restaurants as well, bars and restaurants, folks waiting for a table, congregating outside. Please try to do a better job with that. Please keep your mask on even if you're outside. I would ask restaurant owners and bar owners, even simple things like putting tape on the ground, on the sidewalk outside, folks are waiting in line so they keep a distance, make a huge difference. So it's a little disappointing we're starting to see some of the crowding. I want you to go out for dinner. I want you to go out. I want you to spend money in these restaurants. But please try not to bunch up while you're in a bar or waiting in line. Try a little harder, please. Okay. I want to talk for a second about the issues we're having with folks in their 20s. So, and by the way, this isn't a Rhode Island thing. This is a struggle all around the country. Last week I spoke about the outbreak at PC and to a lesser extent of the issue we've had at URI. And I've been asked, how has that impacted our overall number of cases? So I wanted to share a slide that helps illustrate what we've been seeing in the data. And I'd ask if you could please put the slide up on the screen. So if you look at this slide in front of you, it's pretty alarming and pretty crystal clear where we're struggling and what age group is not following the rules. The slide on your screen shows the 3-day average of cases among different age groups over the past 2 months. And as you can see, every single line is relatively flat. In fact, some of the lines are generally decreasing for every age group, except one, the red line. The red line indicates cases among people between 19 and 24 years old. Between 19 and 24 years old had a huge spike about 2 weeks ago. It's notable, it's obvious, it jumps off the page. We are working closely with our college leaders to get this under control. And the good news is you'll see also from what's in front of you that the cases are coming back down in that age group. It was a spike and it's coming back down. Having said that, it's still the age group, 19 to 24, where we're seeing the most spikes. We're seeing the most cases. And the reason, which we know from our case investigations, is that college students are still socializing with different groups of friends, not wearing masks, and we know that that causes the virus to spread. So I'm talking directly to the group of folks in that age group and asking you to do better. You may be young and healthy, but you're spreading this to people who aren't young and healthy. And so for the sake of your loved ones, for the sake of the rest of the Rhode Island community, for the sake of the many, many, many restaurant owners and hotel owners that I have heard from whose businesses are suffering because we went back on the travel restriction list for New York and Connecticut because of the outbreak at PC, and in this age group, I'm asking you to do better. By the way, most college students and most college administrators, I think, probably are doing the right thing. And student leaders have stepped up on their campuses to help us out. And I want to thank you all for doing that. And frankly, we want to hear more from you. But to those of you who aren't doing everything you need to do, it's time to get a whole lot more serious. Today I'm announcing that we're going to be convening a young adult task force led by students from across Rhode Island's colleges and universities. The task force is going to include also local leaders and representatives from high-density communities, and they're going to develop new recommendations for meeting students where they are and communicating our public health guidance in a way that's clear and effective and actually drives behavior change among these college students. The challenge we see among college students, and we know this because we do the case investigation talking to them, is they're just mingling with too many people. I'm asking you, the name of the game is keeping your groups small and steady. If you're living in a dormitory, hang out with the people in your room, not with the people in your entire dorm. If you're renting an apartment, hang out with your roommates in your apartment, not with the people, if you're renting an apartment in a house, not with everybody in the house. And if you are with everybody else in the house, you have to wear your mask and you have to keep a distance. We are finding that young people are socializing, the groups are just too large. They just are having too much social engagement with people in the neighboring house, in the neighboring apartment, and without wearing their masks. We're seeing pretty poor mask compliance in social settings by this group of 18 to 24-year-olds. So I'm just asking you to do better. This area is going to be an area of focus for the Young Adult Task Force, and we're going to be relying on them. Leaders on college campuses, leaders from that age group to help us. We need to figure this out. Maybe it's incentives. Maybe it's a different way of communicating. Maybe it's providing more mental health. I know it's frustrating to be in quarantine or to be in isolation. So we'll have more information about the task force in the coming week, but I'm excited to try it. We have to do something different. We're not reaching these young people. They are not following the rules. They're putting the rest of Rhode Island in danger. And so to the college leaders who are doing a good job, thank you. To the college students doing a good job, thank you. And to the leaders who are going to step up and help us, thank you. I think that we're going to get some good ideas out of this where we can bring our message more effectively to that age group and maybe provide some interesting incentives for them to actually wear their masks and keep their pods small. Okay, shifting gears, I want to talk for a minute about the Take It Outside campaign. This is going great, and thank God Mother Nature is cooperating. We had a beautiful weekend, and restaurants saw some pretty good business. I have to say I've been inspired, really, inspired and humbled to see how hardworking and creative our restaurant owners and retailers are. When we launched the Take It Outside initiative, people really stepped up. They really stepped up and have come up with unbelievably creative, can-do ideas to help themselves and keep themselves in business. We announced it 2 weeks ago, $1 million in funding to help all businesses move outside. And at that time, we asked for municipalities, industry associations, chambers of commerce, other organizations to send us proposals on how you would use the money. I wasn't sure how many we would get or if it was a good idea, but in a crisis you have to try things. I thought maybe we'd get a couple dozen proposals, which would have been great. Instead, in only 2 weeks, we've received over 80 proposals, and they are fantastic. These are good ideas, innovative ideas, ideas that include simple things like outdoor tables and lighting, or creating a lending library of heat lamps. I thought that was creative. Lending or purchasing additional equipment for businesses, Wi-Fi hotspots outside of state libraries in order to allow for expanded outdoor programming. So because of the fact that the quality of these applications is excellent and the fact that we have so much demand, today I'm announcing that we'll be adding an additional $4 million to this program, bringing the total amount of funding to $5 million. Tomorrow, we'll be announcing the first round of those grants, the first $3 million, and then we're putting aside an additional $2 million for a second round. So if you have submitted a proposal, you'll find out tomorrow if you receive a grant. If you haven't yet done it, but you think it's interesting for you, go visit takeitoutsideRI.com, because we're going to do a second round. And again, it's for all kinds of businesses, libraries, nonprofits. The science is crystal clear. It is much safer to be outside. So if we can help you to take your business outside, or allow people to shop outside, or exercise outside, or study outside, then put in a proposal and we'd be happy to look at it. I have a small bit of good news for restaurants. I will say to all those, especially restaurants who've been taking it outside, huge thank you. It's really hard, really, really hard. I know you're putting on a brave face. I talk to a lot of folks who own restaurants and waiters and waitresses and ask you how you're doing, and you're just getting by. I know that's how you're doing. You're trying to survive. So I want to thank you for your strength and your courage and your community spirit, and I hope Take It Outside helps you. I have a little more good news. Because it's clear that it's much safer outside, and because you're doing such a great job following the rules outside, effective immediately today, we're going to be easing the table spacing requirement outside from 8 feet to 6 feet. So starting now, outdoor tables for outdoor dining only have to be spaced 6 feet apart instead of 8 feet apart. Now I realize this isn't a very big deal, it's only 2 feet, but it is I also know you're hanging on and every dollar matters, so it is my hope that you can fit a few more tables in outdoors and do a little bit more business for the next couple of months. So I hope those extra tables will help you just a bit, and I want to thank you again for your cooperation, and that's effective today. Just a couple more announcements. I want to take a minute to talk about testing and begin with our K-12 testing system. So to give you a flavor for it, over the past 2.5 weeks, we've tested about 4,000 students, teachers, and staff at our public and private schools through our separate K-12 testing system. Of those, we've identified 60 positive cases through the K-12 system. Additionally, we have found another 100 cases among the school community just from the regular testing systems. And in that 160 cases, it's roughly equal between the kids who are learning from home and the ones who are in school. We set up here in Rhode Island, we're the only state in the country that I know of that has a dedicated separate K-12 testing system. We did that because we wanted to make sure our teachers were safe and it was convenient for them to get tested, and the same for everyone in our school community, students, everyone, families, et cetera. And we wanted to be able to move fast. You ought to be able to get a test that day and also get folks into quarantine quickly. I will tell you, after doing this for 3 weeks, it's going very smoothly. It is not perfect. It's a brand new system. We're the only ones doing it, but it's going incredibly smoothly. 4,000 tests have been processed in a short period of time. Results are getting back to folks. We are pretty quickly identifying positive cases, getting them into isolation, doing contact tracing, and at this point, we're not seeing any evidence of widespread transmission of the virus in schools and in the school community. So it's going very well so far. Huge thank you to the National Guard. Would not have been possible without the Rhode Island National Guard and their leadership. And just a big thank you to everybody, to principals, superintendents, teachers, parents, students, everybody who's rolling with it and being patient as we learn together how to get the kids back to school safely with coronavirus. The biggest area of confusion so far that we have is from people saying, how do I get my test result? When do I get my test result? So I want to try to address this, and I'm happy to answer questions. If you're sick, if you have symptoms, so if you wake up and you feel sick, or you're in school and you start to feel sick, you call the testing number and we get you tested that day. You're going to get 2 tests, a rapid test and then a test that takes a couple of days to get you the results. In most cases, you're going to get the result of your rapid test that day. Not while you're there, but later that day. If you get your test after 3 o'clock in the afternoon, it might take till the next morning for you to get your result. But if you get there before 3 in the afternoon, we guarantee you'll get your result the same day. If it's late in the day, you might have to wait till the next day, first thing in the morning. If you're asymptomatic, so if you're getting tested because you were told you were close contact, or you're getting a test even though you're not sick, you are only going to get 1 test. And that test will take 2 days before you get your results. Why is that? Because the rapid tests aren't as effective on people that don't have symptoms. So if you go to the K-12 testing site, but you're not sick, you'll get a test and you have to wait a couple of days for your results. Now here's the part that people are getting confused. If you test positive, you're going to get a phone call from the Department of Health. So you test positive, they will call you. And please answer the phone. It'll come up, your caller ID, it'll be clear it's coming from the Department of Health. So if you're positive, we'll call you from the Department of Health. But if you've been tested and it's negative, you're not going to get a phone call. You're going to be emailed your results. You'll get an email with your results. So if you went to get tested and it's been like 3 days and you haven't heard anything, check your junk folder or your spam filter. You probably got an email and it's lost someplace in your inbox or your spam filter. If it's still not there, then call back. We're saying this because we have a lot of people calling the very next day, and it's overloading the phone line, and it means the hold times can be, longer than we want them to be. In the next couple of weeks, we're going to be rolling out an online portal, which will make everything easier. And so when you get tested, you can just go to that portal and get your results, but we're not quite there yet. So the thing I'm trying to say today is, if you go and you're sick, you have symptoms, you'll get that result that day. And if you're positive, you're going to get a phone call. If you aren't sick, you have to wait a couple of days to get your results. If you're positive, you're going to get a phone call. But in any of these cases, if you're negative, you're just going to get an email telling you the result and telling you it was negative. And if after a couple of days you haven't heard anything, check your spam filter. If there's nothing there, please call us and we'll figure out what's going on. So I hope that's clear. And again, as I said, in a couple of weeks, we're going to be rolling out an online portal where everybody can just go there and check their results. Now, a couple other reminders. If you have symptoms, if you feel sick, and you test negative, that's good news, but you still need to wait until you receive both of your negative test results and you're symptom-free for 24 hours before you go back to school. If you were tested because you were told you were close contact, then you still need to quarantine for 14 days, even if you test negative and feel fine. And to remind you, a close contact is if you've been someone who's positive within 6 feet of them for more than 15 minutes. To be clear, this is a big deal for schools. To be clear, you are not a close contact just because you're in the same classroom or in the same school with someone who has a positive case. The Department of Health will call you and tell you if you've been in close contact with someone who tested positive. You don't need to quarantine unless the Department of Health tells you to quarantine. By the way, I know quarantine's a drag, especially if you're not sick. But I'm asking you please to take it seriously. Quarantine means staying at home. You can go outside, get some fresh air, but if you're in quarantine, if the Department of Health has told you you were in close contact and you're in quarantine, you can't play sports, you can't hang out with your friends, you can't socialize, you can't go out or to the store, or, like I said, being with your friends. It means staying at home. This is rough. I hear you, this is rough. So to be clear, this means you're not sick, you feel fine, you've tested negative, and you're sitting at home for 14 days. Yes, I'm sorry, those are the rules as they are. You can do virtual school from home, and please don't play sports, don't socialize, because there's a possibility that you still may have the virus just because you tested negative on one day, 5 or 6 days later, you could find out that you test positive. So following the strict quarantine rules is really the only way to prevent outbreaks and keep schools open. By and large, you're doing a great job. Everyone's doing a great job, and we've had no real outbreaks or problems in schools or widespread spread, but I'm sorry, this is very inconvenient. I have some good news related to testing. I had a phone call 2 days ago with the other governors and the White House, and we were notified that this week, Rhode Island, along with every state in America, is going to start receiving a new, pretty amazing, game-changing, rapid type of COVID test. It's called the Binax Now test. The Binax Now is a completely different kind of a test from anything that we've been using. It doesn't require a machine to process, and it's very easy to administer. The swab is very comfortable, relatively comfortable, and you get your results in 15 minutes. Rhode Island, our allocation is over 300,000 of these tests between now and the end of the year. So we're going to be getting more information on exactly when we'll be receiving them and in how many installments. But this is huge. This is great news. So 300,000 tests of the Binax Now for Rhode Island from the federal government. And as I said, they're comfortable, they're rapid, and they're very effective. And I think the doctor may be talking about this. What we're doing right now is trying to figure out where we deploy these tests. So Dr. Alexander Scott is working with the testing task force to figure out what's the highest and best use of these 300,000 tests. K through 12, colleges, urban communities. It's a powerful tool, and so we're trying to figure out exactly the best way to use them. I will have more to say about that next week once we have finalized our strategy. Finally, the happy topic for the last, Halloween. It's a question that I've been getting frequently. So I have good news. The show will go on. This year there will be Halloween in Rhode Island. So get ready for your costumes. But like everything else, it's going to look different. So, and there'll be extra precautions that you have to take. But the good news is you can get a costume, you can go out and get your candy, and you can eat a lot of candy. I'm probably going to get in trouble from the doctor for saying that, but it's Halloween, so I hope you eat a lot of candy. Dr. Alexander Scott is going to speak in more detail about what Halloween will look like, but I'm just going to give you a quick high-level overview. Remember, outside is better than inside. Outdoors, better, safer. Trick-or-treating is okay. Go in a small group. Who you know. Wear your mask, not a Halloween mask. You can wear a Halloween mask, but that won't protect you or prevent you from spreading the disease. Wear a regular cloth mask or surgical mask. Keep your group small. Wash your hands constantly. Try not to stay out forever. And, you know, just be sensible about it. No big parties. No house parties. No house parties. We are going to be on high alert for big Halloween house parties. So we're trying to do the right thing here, allowing the kids to trick-or-treat, and she's going to provide the rules. But I want to say to everyone else, and particularly college students, I know this is a big time for partying, Halloween costume parties. Don't do it. Don't even try it. We will bust your party. We will fine everybody $500. Don't even think about it. So Halloween will go on for the kids. They can do their outdoor trick-or-treating safely. For the rest of us, for everyone, no social distance. Limit is 15. No big parties. No gathering in bars. No big Halloween bashes. You know, be smart about this. We don't want to have a repeat of what we saw after 4th of July, or frankly what we're seeing all over the country, where one bad weekend, one big party, one event can cause to a big outbreak 3 or 4 weeks down the road. And the last thing I will say is this. I would just ask you to be smart about it. There are certain communities which have a higher prevalence of the disease, are more densely populated urban communities. So if you live in one of those communities, just be careful. We now know how to keep ourselves safe. So follow the rules, use your common sense, but go ahead, get your costumes ready, and enjoy Halloween.